Hey family, this is Pastor Jennifer, lead pastor here at Jackson Revival Center Church, and I want to thank each and every one of you for taking time out of your busy day to meet me in the break room. We are so excited to have with us today Joshua McClain of McClain Missions.
Yes.
Joshua is also a minister of the gospel. He's also a gospel artist. And so Joshua, we're glad to have you here in the break room with us today.
Thank you.
So today we're here to talk about the fact that open enrollment season is right here upon us.
Yes.
So let's talk about what open enrollment is and how people can take advantage of that.
Got it. The open enrollment is actually the annual enrollment for people that's actually on Medicare.
Okay.
And they sit on TV, they sit on all kind of commercials.
Right.
They gain their Part A, their Part B, and things like that. And they need that guidance and that help during this time of being. There are prior providers that we actually work for as well, that we actually work with, like Humana, Cigna, WellCare, United Healthcare. All of them try to provide something for people as well during this time of season, which is October 15th to December 7th.
Okay. So for people who are on Medicare, let's talk about the difference between Part A and Part B.
That's a good question.
Okay.
Part A is normally your hospital, and B is your medical.
Okay.
And so Part A is basically kind of covering inpatient, things like that as well. And then Part B is your medical. Now, just keeping Medicare, original Medicare, it only covers 80%.
Okay.
So they're responsible for paying the 20% out their pockets.
Gotcha.
So a lot of times they have no dental, no vision, no hearing, and their prescription is a Part D. And what I've been finding out, a lot of people have Part D, and they have Medicare A and B, but they don't understand what other things are out there for them to have.
Okay. So let's talk about some of the things that are out there.
Yes. Now, keeping original Medicare, you have to take the 20%, you have to pay the 20% out your pocket as well. Now, what I normally recommend is that a client, they normally go to a supplement.
Okay.
So Medicare Supplement is something that people actually can get, like a Plan F, a Plan K, a Plan G. What the Medicare Supplement does, it covers what original Medicare does not cover.
Gotcha.
Okay. But the only thing about the supplement plan, many people here in the state of Mississippi, they live on a fixed income.
That's right.
And it's all about making sure they have good preventive care.
Right.
Make sure they have dental, because, like my mom told me a couple months ago, she was like, when she got in the plan with me, she was like, Josh, I did not know how important it is, because if their dental work is not taken care of, it can cause diseases, all kind of stuff.
Absolutely.
So a lot of this,
horrible things. Yeah.
Yes. So they have no vision for their glasses. I had a lady last year was telling me how she would go to Dollar General and she was paying like $5 to get glasses, and it wasn't even the actual glass she needed for her eyes.
Right.
So they have no hearing. So you got a lot of people that's hearing impaired. They can't hear that good, so they need hearing aids.
Right.
And also prescriptions, prescription-wise, with their Part D plan, they still have to pay out their pocket. So we normally try to see if they fall up on a fixed income rate, a low income fixed rate, they can get extra help with their medicines too as well.
Okay.
So normally, keeping the original Medicare, keeping Medicare Supplement, you got to pay your Part B, which Part B has a standard monthly premium of $148.50. And then when you get into Medicare Supplement, you got to pay for that too. And also, you still have to pay for your dental, your vision, your hearing, all that kind of stuff. So you constantly have to pay so much out your pocket. So what we recommend is the MAPD, which is the Medicare Advantage plan.
Okay.
What it does, it gives them the 80% they currently have, and also the 20% that they need. So that's their rooftop. And then the A and B, they already got the A and B. Now, everybody cannot get Medicare.
Okay.
They normally gain A when they have worked at least 40 quarter hours of their lifetime of history. And they gain that, and once they gain their Part A, they are entitled to their Part B. Okay. But everybody does not get it. So it's the people to be qualified for Medicare, you got to be 65 or below age with end-stage renal disease or ALS. So there's certain types of people who can qualify for it.
Okay.
You got to have at least 24 disability payments, and if you're disabled. And a lot of people right now are on dialysis here in the state of Mississippi. So I've been actually going to dialysis clinics. A lot of them actually don't have the 20% they need. So they'll say, Joshua, can you come in here and help our clients with the 20% they need? Because they're having to pay all these co-pays when they go to dialysis places. So we actually help with that as well, too, to make sure they get the Advantage plan where they get everything in one bundle together. But having the house, the Advantage house, it gives them the A, the B. They gain the C, which it gives them dental, vision, hearing, prescriptions, gym. It gives them gym membership for free. And also it gives them the Part D. So they get everything up under one house. And a lot of the Advantage plans right now through the carriers we actually work with are zero monthly premiums for them.
Wow. So how do they get this plan?
Yes, they can actually enter to the plan with me October 15th to December 7th. And what we don't do, so make sure they understand, we do not take away your A and B. A lot of people feel that A and B is gone. But what it does, it goes up under the house with WellCare. It goes up under the house with Cigna. It goes up under the house with, so basically that Medicare goes up under one house. And just to tag off this as well, I had a guy last year in Columbia, Mississippi, was telling me how every time he went and showed his Medicare card to the doctor, they would charge him $100 every time he went. And so when I came in, I found out, I always looked the prescriptions up, the doctors, and I seen what network that he was actually up under. And we was able to give him a zero to see that doctor. So when he go see that doctor, zero copay. And so a lot of times people don't understand all about Medicare. So it's all about trying to educate them and make sure they have all the things that they need.
Get them under the right plan.
Yes.
So we know Part A covers inpatient hospital services, hospice
medical,
sometimes for those who need it, operating room, recovery room services, care in special units, ICU, CCU, inpatient drugs, hospital meals. So all that falls under A. Then under B, you got your doctor visits, your outpatient care, your ambulance services, lab tests, blood draws, urgent care. So that's covered under A and B. But then they can also find coverage under the Medicare Advantage plan for
Part
vision,
C.
for dental, for hearing,
office visits,
those
like
kinds
that.
of things. So help is available, is what you're saying.
Yes.
But you have to take advantage of that between October
15th to December 7th.
December 7th. Okay, you can only access these particular things during open enrollment.
Yes, annual enrollment, which it helps them get the guided help they need. And one thing I want to say too is that with keeping their original Medicare, it puts them into a category of having to pay the deductibles. See, every year they have to meet the deductible. One lady told me last year how she had to take a loan out just to pay for her deductible with the original Medicare.
Wow.
So once they get into the house of the Advantage plan, it kind of takes away their deductibles. So it helps them to save money. That's the key, is just helping them save.
Right.
And then some people actually can get Medicaid, where Medicaid, sometimes we help those people that's needing help with Medicaid. And so we take them through a little process, and then what they can do is that Medicaid can pay their Part B for them. And put that back in their checks. As well, on their Social Security checks.
So who is eligible for Medicare? Once again, for Medicare, who is eligible for Medicare? People
that's 65 or below, they are disabled, ESRD, ALS, and they have worked at least 40 quarter hours, their lifetime. And also, if they're disabled, they have received at least 24 disability payments on like a 2-year thing to receive those. Because some people actually always call me and say, why can't I get Medicare? And I said, well, it's probably because your quarters. And we found out that they didn't have the quarters they needed as well.
Okay, and then who is eligible for Medicaid?
Medicaid. Now, Medicaid is kind of different. It flows up under income source level. So the income is normally under a certain threshold. And normally, I think a husband and wife is like $5,000 for the year. And I think an individual is normally falls under $1,000 a month.
Okay.
But once they get Medicaid, they can be qualified for DSNP, which is called Dual Special Needs People. And that qualifies them as a QMB, which is Qualified Medicare Beneficiary. Or they can get a plus, which they get additional Medicaid services. SLMB plus, full dual eligible. And Pastor, with those kind of people, they can actually qualify for a food card every month. Where they can go and get their groceries every month. The first of the month, they can get groceries. They can get access to more of their dental care, just all kind of great benefits for the ones that's actually dual SNP people.
Okay. All right. What else do the people watching today need to know as it relates to annual open enrollment, the services you provide? What else do they need to know?
Well, they just want to call me. We get real busy during this time of season, but just to be educated on it, just to make sure they're making a good informed decision. Because a lot of times when they get all these phone calls in, they'll understand who they're talking to. And so here at McClain Missions, we have a whole team of agents that's willing to help them, to guide them to the right way. Because over the phone, they talk to foreign people. And a lot of times we always tell them, do not give your Medicare number out on the phone.
Right.
Because what they'll do is they'll put them in a plan, and when January the 1st comes, they don't know what they got.
Right.
So we make sure they understand where to go to the doctor at, where to go to their vision doctor, where they go to their physicians and all that kind of stuff, so that way they can have a greater stance on everything.
So let's say we have someone who's elderly, they have a doctor they've been using for years, they're very comfortable with their physician. If they have Medicare, or if they take one of these Medicare Advantage plans, can they continue to use their primary care physician?
Yes, they can.
Okay, very
Yes,
good.
they can. Because with the Medicare Advantage plans, they normally have different type of networks. They have the HMO network, which is the Health Maintenance Organization. And basically with the Health Maintenance Organization, it keeps them on a low-cost sharing for all their stuff. But if they get a PPO network, which they just, in 2022, a lot of the plans that's coming out, Humana, Cigna, WellCare, all of them, they're bringing out PPO plans to people.
Okay.
And the PPO allows them to go to whomever doctor they want to go to.
Okay. And tell them what PPO stands for.
That's Preferred Providers Organization.
Okay.
So they can actually go straight to the physician they want to go to without being tied down. It's just that they do have a higher cost sharing fees on that, but keeping them in the HMO network kind of still gives them that low cost sharing.
Okay.
You know?
Very good. Because I actually have, when you're a pastor, you kind of have a lot of different things brought your way. But we've actually dealt with seniors who, have been approached and changed plans, and then didn't realize in making this change, they lost that particular benefit, and so it's good to have somebody who can walk them through things, who can answer their questions and help them make sense of all the benefits that are available, and make sure they're receiving the benefits that they're eligible for.
Yes.
Because sometimes people are paying things out of pocket unnecessarily. They've worked, 30 years, 40 years, 50 years,
Yes.
and they have paid into the system. They've done all of that and just don't know what's available for them.
Yes,
so,
and then transportation, like a lot of these plans, they can get transportation to the doctor, to the doctor office and things like that. They get like a 40-mile radius. So they'll come pick them up. Take them to the doctor, make sure that they're seen about. They'll pick them up. That they normally call in 72 hours before their appointment, and they get that appointment set up. And so they get their scheduled appointment. They pick them up and take them back home. Good.
That's very good. Especially sometimes you have elderly people who no longer drive, and their children may not always be available to take them to that appointment. So this is good to make sure, as you said, they're getting that preventive care.
Yes.
They're getting to the appointments they need to get to, and to ensure that they stay healthy.
Yes.
And also, if they're not healthy, that they can get the help that they need.
Awesome. And we've been having another provider been working with us, Oak Street Health, which they're on North State Street and Ellis Avenue.
Okay.
And with them, we've been, a lot of clients don't have doctors to go to. They don't really have a good physician to go to. So with Oak Street, they can be able to have a 40-minute interview with the doctor.
Okay.
And they can kind of see exactly what's kind of going on with them as well. And if they have Medicare A and B, they can actually go to that facility as well too. So we try to give them an option, not just force them to anything, but just try to see the needs of them and what they're trying to look for, what they need help with.
So you can help them in making assessments and then even referring them to doctors if they need one
Yes.
and don't have one.
That's
based
right.
on that interview, they can make an assessment. You need to see
Yes.
this type of physician.
Mhm.
Very good, very good. And so I know the focus for today is on Medicare because it's annual open enrollment. But let's also talk about some of the other services you provide as well outside of Medicare.
Yes.
What else do you and your team
we
provide?
do life insurance. We do
Okay.
health insurance. We do
Mhm.
dental and vision.
Mhm.
That's by itself.
Mhm.
And we also specialize in commercial.
Okay, okay.
We commercial lives as well, and we do all kind of stuff like fire insurance. So
Okay.
we basically like one house of
Mhm.
insurance to
Mhm.
make sure people have all the things they need for us when it comes to needing insurance. They can
Okay.
actually come to us,
Mhm.
and also now our website is updated where they can
Okay.
actually schedule appointments.
Mhm.
They can tell us what they're looking for,
Mhm.
and we can steam them into the right place as well too.
Very good. And that's something that as a pastor, you're going to hear me harp on. And probably every pastor watching will agree with me. One of the things I really put out before the people is to make sure if you're a millionaire, you don't need a life insurance policy. But if you're not a millionaire, you need a life insurance policy so that when you do pass on, and all of us will at some point in time, we all have an appointed time. But you want to make sure that you're not leaving a financial burden behind for your family. And we've seen time and time again where people have passed unexpectedly. Either no one knew that they were sick, or there was a car accident or a four-wheeler accident. I mean, all kinds of things happen. Somebody was in the wrong place at the wrong time. Someone was shot. A million things have happened.
Yes.
And then you have these families who are not only grieving the loss of that loved one, but now they're bearing the burden of trying to raise funds to put their loved one away in a way they feel they would like to.
Yes.
And so that can be a major, major burden. And there are so many different types of policies available so that doesn't have to become a burden for that family, a burden for that church. I have seen one death put an entire family into a cycle of poverty because this person was the main breadwinner for the family. And everybody kind of was depending on them. And then when they were no longer there, their income was no longer there. Now everybody is at a different standard of living. And it really did put that family into a cycle of poverty.
Yes.
And all of that could have easily been avoided by having a simple life insurance policy in place. And many times people will say, well, I can't afford it. Well, you can afford it. You can't afford not to have it.
That's right.
And when we say we can afford it, I say that because you can have life insurance policies, especially when you're younger, for how much, Joshua?
You get like $25 a month.
Yeah, something as
$30
simple
a
as
month.
$25 a month. Most people blow $25
Yes.
a month. I mean, whether it be on shoes, hair, nails, and all of those things are nice, but let's cover the basics first. Let's
right.
make sure we're not leaving a financial burden for those coming behind us before we do the other things.
Yes.
And I'm all about self-care and all that, so don't
And one
come
thing
for
I
me
do
on
too,
that one.
and one thing we want to bring up too is that
Yeah.
even with having that life policy, now a lot of the policies that's coming out now, they have living benefits with them.
Yes.
And I think that's good because if a person has $100,000 policy, let's say $100,000, $200,000 policy, they can draw from while they're living, just in case their health does go down on them. We have those as well too. So it's all about trying to think ahead,
right,
and get it set up ahead of time,
right,
just before something wants to happen.
That's
And
right.
like right now we are in October, Cancer Awareness Month. We also do cancer policies for people,
right,
because a lot of times chemotherapy can cost you between $7,000 or more. And so we do have programs there that can actually help them with that, and also give them that amount, like $20,000, $30,000. So just in case that happens or something happens with that, they can have that cushion to know, hey, you know what, I do have this over here that I set up with McClain Missions, and I have this over here, just to have that leadway to have something that they can actually run to.
Okay. Very good. Well, is there anything else you want to share before we go?
Well, I just thank God for the opportunity. Pastor, I just thank God for you, because I remember years ago, I think you remember this, but I think I had a small little old minivan.
Uh-huh.
And I remember how my minivan it went out on me, and I was just like, it was times I was going to clients' house. I would have to keep water, just try to make sure my truck was running hot. I remember how it just shut down me one day, and I didn't have anything. And I thank God for Jackson Revival Center, and how now I've been able to just think about those moments. Yeah. And how you was like, no, you gotta get out here and see people. I was like, Pastor, I'm like, and how you gotta get out here and see people. You gotta help people, and that's what it's all about. And that's that one. Just you all sowing that in my life to be able to help me with my business and stuff to get me back on the road. And now I just thank God for those moments because now I could be able to still help people, to be able to go forth and be able to do everything God called me to do. Yeah,
absolutely. And you're doing a great job, and I'm proud of you. It's been a blessing from the Lord to see where you started from, and then to see you get a house, and now to see you build a house. just the way that God provides, the way that God promotes, that the Bible says in Matthew 6:33, seek ye first the kingdom of God and his righteousness, and all these other things will be added. And I've seen you put God first. I've seen you put God first at times that it required great sacrifice on your part. But you said, no, I want to honor God. And you've been faithful to honor God with your life, with the substance of your increase, with your family. Your family serves God. Beautiful family, wife, daughters, mother-in-law. But to see you guys, how you just serve God with all of your heart. And I've definitely witnessed your heart for people. Your desire to be a blessing to people, your desire to help. And I've been able to refer people to you, and they will come back and say, he really helped me out. I got what I needed, and I'm very happy. And we've seen people in the church get life insurance policies from you. And, 6 months down the road, a year later, that life insurance policy was truly a lifesaver for them because the unexpected happened. But they didn't have the burden of trying to figure out, how they were going to do this and because that plan was in place.
That's right.
And, so it's been a blessing to have you around, especially for people who are on a fixed income or working with a smaller budget, people who thought they couldn't even be insured. You've been able to find the right fit for them, whether it be health insurance, life insurance, help our elderly with Medicare. So I want to thank you for just your heart to serve. And the blessing you are to us as a church family and to the community as a whole. You're doing a great work.
Thank you so much.
Absolutely. Thank you. Well, listen, I pray that today has been helpful for you. I'm sure there are many of you who may have questions. There are things you would like to get answers to. So we're going to put the information there at the bottom of the screen. We're going to let you know how you can contact McClain Missions. Again, this is Joshua McClain, and he has a team of individuals who are in place and ready to serve you. So if you're interested in life insurance, health insurance, if you need help with Medicare, Part A, Part B, the Medicare Advantage plan, this is annual open enrollment season. I want to let you know I am not a life insurance professional. I'm not benefiting from this in any way, shape, form, or fashion, other than to know I'm helping someone do what God has called them to do. And so we are so excited for the opportunity for those of you who need health insurance, life insurance, help with Medicare. You've got a one-stop shop here to help meet that need. So again, the information is there at the bottom of the screen, and we pray that you have found today's information helpful. And if you have, please take time to share this with a friend, tag somebody, invite somebody to watch, and we're going to invite you to join us back next week, same time, same place. Until then, it is our sincere prayer that God's absolute best would be yours in every area of your life. Y'all go make today a great day.